The ligamentum teres of hip joint. What is ligamentum teres of hip joint? The ligamentum teres of the hip is also known as the round ligament of the hip. It is a ligament within the hip joint that connects the femoral head, the ball of the hip joint, to the acetabulum, the socket. It is an intra-articular, extrasynovial ligament, meaning it is located within the joint capsule, but it is outside the synovial lining. While previously considered a vestigial structure, recent research suggests it plays a role in proprioception, nociception, and hip stability. What are the attachments of ligamentum teres? The ligamentum teres attaches to the acetabulum, hip socket, and the femoral head, the rounded top of the thigh bone. Specifically, this involves acetabulum. The ligamentum teres has multiple attachment points on the acetabulum, including the transverse acetabular ligament and the acetabular notch. Femur. The other end of the ligamentum teres attaches to the fovea capitis. A depression on the head of the femur. Is ligamentum teres intracapsular or extracapsular? The ligamentum teres is intracapsular ligament, but it is extrasynovial. Intracapsular. The ligamentum teres runs within the joint capsule, which is a fibrous tissue sac that surrounds the hip joint, enclosing the femoral head and acetabulum. Extrasynovial. The ligamentum teres is positioned outside the synovial membrane, the inner lining of the joint capsule, that secretes synovial fluid to lubricate and nourish the joint. What is the importance of ligamentum teres of hip joint? While initially considered a vestigial structure, research indicates that ligamentum teres has several important functions. Number 1. Blood supply in infants. In infants, the ligamentum teres is crucial for blood supply to the femoral head. It acts as a pathway for the foveal artery, which originates from the arterator artery, to reach the femoral head. This blood supply is essential for the growth and development of the femoral head in infants, and is a significant source of blood to the femoral head in this age group. Number 2. Proprioception and nociception. The ligamentum teres contains nerve fibers that contribute to the joint sense of position, proprioception, and its ability to sense pain, nociception. Number 3. Hip stability. The ligamentum teres can act as a secondary stabilizer, particularly at the extreme ranges of hip motion, flexion, and external rotation. It helps to prevent subluxation or dislocation of the femoral head in these positions. While the ligamentum teres' role in providing a blood supply diminishes with age, its contribution to joint stability, proprioception, and nociception remains important in adults.